Hello, I'm Dr. Niskoda, and welcome back to AZH Wound Center in Milwaukee, Wisconsin for another edition of a follow-up version of the wound care window. Yes, we're going to provide you with some more follow-up. I'm also going to introduce you to one of my patients who is actually a viral sensation. Thanks to all of you viewers, we have several videos that have gone viral. This young lady is currently at 2.5 million views. Very interested in her wound, and we're going to tell you her story. What I'd like to introduce you to is Miss Donna Prognow. Miss Prognow, how are you doing?
I'm doing fine. How are you?
Good. You are healing quite nicely.
Thank you very much.
And I told you we weren't sure how this was going to go, but it's actually gone very well.
True.
And congratulations, you are a viral sensation. Have you ever gone viral before?
No.
No, neither have I. I've had a virus, but not that virus. Anyhow, do you mind if I tell your story here?
Go right ahead.
All right. So, those of you might remember our debridement a few months ago. This young lady presented with a pretty impressive heel Eschar. Now, let's take a look at how she presents today. Here you can see what is left of that wound, and we still have an ulcer, obviously. But look at the significant progress. And if you remember what I told you in that initial video is we did have concern for the underlying bone. I wasn't able to feel it then. I can't feel it now. And that healing progress that she's made really is clinically the evidence that we look for to demonstrate that there is no bone infection. Wounds do not make progress like this if the underlying bone is infected. So clinically, there is no evidence of osteo. And as you'll see with debridement and good wound care, these patients can heal wounds even as significant as Ms. Prognow had when she first presented. The other thing we're going to do today is if you look at this wound surface, you'll see there's some slough and some fibrin on the surface, and I'm going to debride that. I'd also like to dispel a definition that is out there, and that's called maintenance debridement. We're not maintaining anything by doing debridement. We're doing therapeutic debridement. Maintenance debridement is a misnomer. It is a term that I do not like, and I suggest that not be used. When I'm debriding for therapy. I'm removing fibrin, slough, getting down to granulation tissue. I'm releasing growth factors. I'm removing senescent cells. This is therapeutic, aggressive, sharp debridement. Maintaining is keeping the status quo. We don't do that when we debride a wound. But what we're going to do is we're going to debride with a sharp curette, again, my favorite instrument. And all I'm going to do is slowly come across the surface of the wound, removing that fibrinous slough that you see. Once that comes off, the wound should bleed pretty readily. The bleeding is from the surface, the granulation tissue, and that's typically easily controlled with a little pressure. But what you'll note is that we're removing the fibrin, the slough. This actually causes hemagglutination. I won't explain that term. I'll let you look it up yourself. Hemagglutination does prevent the development of granulation tissue, and this is another reason that we aggressively, therapeutically debride wounds to remove the fibrin and slough. We can also take the margins down a little bit. You can see she's getting some epithelialization and rolling of the margins. So again, removing those mechanical barriers is also helpful here. Once this debridement is accomplished, you see the bleeding underneath is easily stopped with just a little pressure. And we'll go ahead and continue her current wound care therapy. Again, I do not feel any bone there. No evidence, clinical evidence of osteomyelitis. Ms. Prognow, I would like to introduce you to the world and congratulate you on your viral success. And again, thanks for letting us share your story. There's a lot of patients out there that have issues like you. Seeing some healing progress gives a lot of people hope, and we can show them that we can prevent amputations. We can provide limb salvage with a good wound care effort. So thanks for sharing your story.
It's been a wonderful journey.
Well, once again, thanks for joining us on this edition of the Wound Care Window. I hope you've enjoyed this follow-up and this personal story. We'll see you next time.